If you're developing severe acne condition, make sure you consult your dermatologist, and your dermatologist will tell you all the necessary precautions and care whichever is essential to make sure your acne does not go into severe form, because the severe the acne, the more the dark spots and more the severe of acne scars as well. All of this will appear very dark and it tend to give you a very uneven appearance on your face. Hello everyone, I am Dr. Keerthana Kalva. I am a Chief Aesthetic Dermatologist at Inform Clinics. Today we are going to discuss about dark spots on face in specific. So why do you develop these dark spots? Is there any permanent cure or is there any methods by which you can avoid these dark spots? I am going to discuss in detail about dark spots today. So what causes these dark spots? First and foremost, it's your sun exposure. Number two, your hormonal imbalance, that can be your thyroid problem or your PCOD or your weight gain or your uncontrolled diabetes. And the third problem is your acne. When you develop very severe acne, you end up with acne scars, and these also look like dark spots. The fourth most common cause is your medication. If you are on any migraine related medication, or if you are on any depression related or any psychiatric related medication or epilepsy related medication, or if your doctor has put tetracycline group of antibiotics, this four kind of medication will also cause dark spots. So how you develop dark spots? These are the causes. What happens is your skin overstimulates the melanocytes. Melanocytes are the cells that gives us pigment. The color, the complexion of our skin is given by melanocytes. So when the top causes are the reasons, your melanocytes multiply much in number, and these multiplied melanocytes, they are scattered all over your layers, from your epidermis till dermis. So that is when you notice your skin has tanned or your skin has become darker, and you have certain areas on your face which happen to look lot more darker than rest of the spaces. So that is when you say you have dark spots. So in dark spots, there are two types. One is dark spot, other one is dark patches. Dark spots are commonly seen in the form of freckles, which you often get it over here, or moles. Now moles are of various types. You can have a small mole growing into bigger size, or you can suddenly develop multiple moles. All this happens more naturally. Then you have dark patches. You develop dark patches either due to melasma, which is like a butterfly hyperpigmentation which you see on your face. Then you have pigment demarcation lines, which happens in specific areas of face, like extending from the forehead to temple area, or from your under eye to your high cheek bone area, or you have a vampire kind of lines on lower half of your lower lip, or you also have pigmentation extending from upper lip to lower lip. Now these are the most common pigment demarcation lines you come across. Apart from this, you might also develop drug irritation, or when your skin is very dry and you have over applied some exfoliants, or over applied your retinol, or over applied your other depigmenting creams. That is when your skin develops irritation, and it develops a dark spot in some specified area wherever you have developed inflammation or irritation. This is how you see different types of dark spots, and this is how the picture of it is. So what do you do to prevent these dark spots? First and foremost, whenever you're stepping out, make sure you use sunscreen. And apart from sunscreen, if you are going out for shopping and if you are expected to be out for more than an hour, make sure you also tie a scarf. This prevents damage due to sunlight. This also helps your skin protecting from all the pollutants, and also it prevents too much of dehydration of your skin. And apart from using sunscreen and sun protection, make sure you also hydrate your skin properly. And if you have any the drug history which I have mentioned before, if you are any of those drugs, you can go back to your consultant, talk to them, ask them to change the drugs if possible. That can also help you with controlling your dark spots or your hyperpigmentation. And the third most reason, acne. If you're developing severe acne condition, make sure you consult your dermatologist, and your dermatologist will tell you all the necessary precautions and care whichever is essential to make sure your acne does not go into severe form, because the severe the acne, the more the dark spots and more the severe of acne scars as well. All of this will appear very dark and it tend to give you a very uneven appearance on your face. And if you have fourthmost reason, hormonal imbalance. If you have hormonal imbalance, make sure you consult your physician or your endocrinologist. Make sure your thyroid levels are under control, you don't have any PCOD, and if you have any PCOD, apart from taking medication, make sure to exercise so that your hormones stay under control. If you have any uncontrolled sugar, again, you can consult your endocrinologist and also exercise. So when you follow this, it will be much more easier to maintain your dark spots. Apart from doing all this, you still notice that your dark spots are not decreasing, or they have decreased a bit but not up to your expectations, and you still don't have even skin tone. That is when you consult your dermatologist. Your dermatologist, based on severity of your pigmentation, based on the duration, and based on the type of your skin which you have, putting all this into consideration, they are going to suggest you the right kind of treatment. If you are on the earlier stages, or if your pigmentation is not so severe, or something which you have been noticing since a week or so, most probably a change in your face wash or change in your moisturizer or the kind of creams you are using should do the job. But if your pigmentation is for longer duration and you have been suffering with it and you have tried all home remedies and you have tried all topical creams and none seems to be working, that is when you can opt for treatments. And so your dermatologist will suggest various kinds of treatment. One, the first and foremost would be a chemical peel. This chemical peel, you might be wondering, you might be doing all this in your home itself. You using minimalist or ordinary, or there are various kinds of brands. But what you should note is the strength what you get over the counter or the strength which you get on online is different, and what your dermatologist is using is totally different. What your dermatologist uses is a lot more higher in concentration and lot more better in combination. So what they can give is a lot more superior result. So they can go for chemical peel or they can do microdermabrasion that is with the help of suction, they take away the top damaged layer. And the third one would be mesotherapy, where they would be infusing skin lightening agents into your skin. And these skin lightening agents help in decreasing your melanocytes, they help in balancing out your melanocytes with keratinocytes. So all this will also make a good difference in your dark spots. And the fourth most treatment is your laser treatment. So these laser beams, what they do is they target your melanocytes and they blast away your melanocytes. When you say blast, you don't have to worry, it's not painful. All of it happens in a microscopic level. Once the melanocytes are ruptured or once the melanocytes are disturbed, your melanocytes either gets excreted out through phagocytosis, that is your natural body mechanism where there is a system which all dead or not required cells are removed. That's called phagocytosis. And the other mechanism is the skin will expel through the surface. Again, this also you will not notice it, it will happen very naturally. Now all these treatments your dermatologist will suggest based on the severity and based on the type of your skin. They can suggest the combination, they can suggest multiple sessions if need be based on the type of your pigmentation you have. I hope I have clarified all your doubts on dark spots. If you still do have any, please leave it in the comment section. And if you find the information useful, do subscribe to our channel. We at Inform Clinic believe in giving new information and up-to-date information and more educational videos that would be helpful for you guys. If you have any doubts, so please do leave it in comment section. Thank you.